Everyone. It's Susan Snelling here from the National Collaborating Center for Methods and Tools. We're going to get started now. I'm just going to check in with Lena Shirazi, who's assisting me today, to be sure that we're good to go. Lena, everything looking okay?
Yeah, Susan, everything looks great.
Okay, fantastic. Thank you so much. Welcome, everybody. I am a Senior Knowledge Translation Specialist at the National Collaborating Center for Methods and Tools, and I will be leading you through this webinar today. Our focus is on healthy weights-focused methods and tools to support evidence-informed decision-making. And I really want to welcome you to this, what I think is a very interesting topic. I hope you find it so as well. So let's get to it. First of all, a question for you. We just want to get a sense of who's out there. So maybe you're on your own, and that's great, but we have a poll just coming up on the right. If you would like to just click and give a sense of whether you have company as you're participating in today's webinar. So you can click your responses. And I'll just give a minute for those data to start coming in. Okay, so we can close that poll and welcome everybody. Nice to see you all here today. We have lots of people solo, but some of you in groups, so that's fantastic. Welcome to everyone. Just a couple of housekeeping details, nothing too unusual about how we're running this webinar, but just to say that the teleconference line will be muted during the webinar. You can use the Q&A box on the right to post comments or ask questions during the webinar. Feel free to send your questions to all because there may be things that you want to share with the other participants. If you're having connection issues, sound not working well, we do suggest using a wired connection versus wireless, so that might help you if you have that option. And there is a helpline there if you get desperate, but hopefully if you are hearing me now, everything will continue to work well. If there's feedback, which sometimes happens, the audio broadcast box at the bottom of the participants panel can help you to adjust. So another poll question, give me a sense of where you are connecting from today. So I'll just give a minute for those data to start coming in. I suppose it's possible now for people to connect from airplanes and so on now that they have internet on some flights. So maybe we'll need to add an option for I don't know. But we can close that poll now and see where people are connecting from today. And I'll just give you a sense of an outline for today's webinar. Here are the results. A good bunch of people from Ontario, which is where I am too, but from coast to coast, and even some people from outside of Canada. So welcome to everyone. I'll just give a very brief introduction to the National Collaborating Center for Methods and Tools in case you're not familiar with us and the work that we do. And then I'll be talking about a model for evidence-informed decision-making and specifically some steps in the process of evidence-informed public health. And in doing so, I'll make reference to methods and tools that are relevant for chronic disease prevention and specifically healthy weight promotion practitioners that can be found in the NCCMT Registry of Methods and Tools. And I'll tell you more about the registry if you're not familiar with it. Now, the model I'm going to talk about is perhaps familiar to you if you've been exposed to the National Collaborating Center for Methods and Tools before. So we'll be talking about methods and tools for evidence-informed decision-making. A special feature of this webinar is based on our observation that there are a lot of good methods and tools out there that help people use evidence effectively in their work. And these are tools that are meant specifically for a chronic disease prevention audience. So we thought it might make sense to bring them together here and share these with an audience of people who work in chronic disease prevention and healthy weights promotion. So you'll see how these methods and tools may be applicable to the specific kind of work that you do. Now, you may also have great tools to share. What's helped you to use evidence in your work? If you have suggestions of tools that you want to share with others who work in healthy weights promotion, please feel free to put those in the chat box, because that is a good opportunity to just hear from others what has helped to use evidence in your work. But I have some suggestions for you, and that's what I'm really going to be bringing out today. So the National Collaborating Center for Methods and Tools, or NCCMT, our vision is for an effective and efficient public health system in in Canada that's guided by the production and sharing and use of high-quality evidence. So our intent, our mission is to support the uptake of what works in public health into practice. And I'll be sharing some methods and tools to help that happen. So when I talk about evidence-informed public health, I'm talking about the process of distilling and disseminating the best available evidence from research and context and experience, and using that evidence to inform and improve public health policy and practice. So evidence-informed public health provides a systematic approach to incorporating research evidence in program and policy decisions. Another way of saying this is that evidence-informed public health means finding and using and sharing what works in public health. So another question for you, what sector are you from? What kind of work do you do? Give us a sense of that. We'll just take a minute to hear from you. Okay, so we can close that poll and let's just see what kind of work people are engaged in. What am I taking you away from today? We'll just wait a moment for those results to come up, but I'll tell you about the NCCMT Registry of Methods and Tools. So if you're looking for methods and tools that will support the use of research evidence in the work that you do, specifically here today talking about chronic disease prevention or healthy weights promotion, the Registry of Methods and Tools can help you. So there's the link. The registry is a free, searchable, online collection of knowledge translation methods and tools meant for public health. And when you go to the registry, you will find a summary statement written by us at NCCMT to describe the method or tool for knowledge translation so that you'll know what the tool is or what the method is, how it has been useful. You'll also find a link to the method or tool, the actual source that we're talking about. But you also get that background information and the perspective that we can bring from our perspective with respect to the process for knowledge translation. So if you're not familiar with the registry, check it out, and you will see that in the registry, all the tools that I'm going to be talking about today, the methods and tools, I'm actually going to give you the link to the registry entry so that you can see what's there. So if you go to the registry, this is the front page of it, and you can search the registry. You'll see that at the top to find methods and tools that will suit your particular need with respect to knowledge translation. So when I'm talking about methods and tools, well, what is it? What's the difference? Similar, of course, they're related, but by a method, I mean something that can help you to organize the approach that you're using to accomplish a task. So a process, a series of steps. So a framework, for example, might be considered to be a method. A tool, what we call a tool, is a way to do a task. So how to carry out the steps involved in a knowledge translation activity. So a checklist might be a tool, and you'll certainly see both frameworks and checklists talked about today, as well as other kinds of methods and tools. I talked about evidence-informed public health, and particularly when we're working on healthy waste promotion, we need to think not only about what the research says, so what's in that bottom left circle in the Venn diagram, the research piece. I'm going to talk mostly today about that research piece and how to use research evidence in making evidence-informed decisions. But I want to do that in the context that research is not the only source of input that helps us to make decisions. We also see other factors there. So we may ask questions like, what preferences are there in the community for how to approach this topic? What values do we bring to the decision about what we may do or not do with respect to healthy waste promotion? We draw on our own expertise right in the middle there about where to focus. So sometimes we think about, should we focus on obesity prevention or addressing obesity where it exists? Or should we focus on healthy living, diet, exercise? So we may have some expertise, we may have some community preferences around that. Our resources that we have available may also come into our decision making. So although you'll see that I'm going to talk mostly about finding and using research evidence, we're not in any way suggesting that research evidence would be the only factor in making a decision. And I'm sure that you have examples of ways that other factors have come into your decision making about what you do in your practice. So keeping that model in mind, I will now talk about 7 stages in the process of evidence-informed public health. And we'll be looking at methods and tools for each step and applying that particularly to a scenario related to healthy waste promotion. So it can help to have a scenario just to ground these things and make them seem more applied. So I've just created this scenario. Hopefully it resonates as something that would be familiar to you. Now, I want to say right off that although the scenario that I'll be talking about is that, let's say we're working on healthy waste promotion focused on children, and let's say that we are also concerned about weight stigma and weight bias, or perhaps you're hearing those concerns from others in your community and want to be respectful of that. And let's say that an opportunity has arisen to work with early childhood education settings. Maybe there's some openness there, maybe there's a new funding opportunity, maybe it just seems like something that you haven't done yet but wanted to do. So a few assumptions that we're making here just to help this scenario to work. So our question then is, how can the steps of evidence-informed public health be applied to the scenario? So the wheel that I just showed you, how can these steps be applied to this scenario. Now, fair warning, this webinar is not about the findings of the evidence in this area. So although we have some questions perhaps emerging about this scenario, what should we do related to healthy weights promotion focused on children, you won't know the answer by the end of this webinar. You won't. But what you will know is a process so that you can find and appraise and use the evidence yourself, whether it's on this topic or another topic. So our focus here is on the methods and tools for evidence-informed decision-making. It's not about the content of the evidence, but you can do it and we can help, although I think that tagline is already taken. So how can we apply those steps? Well, let's take a look. This is a wheel, so you can start anywhere, but usually when we're starting, if I can say from scratch, then you would want to define the question or problem that you're trying to address. So that's where we will start today. A structure that can help to define the question, so the question of what evidence should we even be looking for, is using the acronym PICO: population, intervention, comparison, and outcome. If it's a qualitative question, we sometimes talk about it as PS, population and situation, but for the moment, let's stick with PICO. So we want to try to be specific about the population that we're working with, what kind of intervention we would like to find evidence about, what we're comparing that to, and what outcomes we are hoping for. Now, it can often be helpful to have a framework when we're trying to define the question and say, well, you know, there's lots of evidence out there. Where should we really look? Now, I'm sharing this framework. It is a really interesting framework, and one of the things that I like about it is that it is evidence-based. So frameworks are great, and they're even better when they themselves are based on evidence. So what you're seeing in this framework, and we're using this to help us define what kinds of evidence we might look for. This framework is from the African American Collaborative Obesity Network, or ACORN. The link is there for you if this is something that's of interest. I know it's a little bit small, so you would need to go and look it up if you wanted to dig into it. But what I want to point out here is that this framework, just by looking at it very simply, can help you to define the kind of evidence that you'd be searching for. So I'm not going to go through the model in detail, but you can see already that they're trying to incorporate not only body weight, but also physical activity, also eating habits, and then they've got some questions that we might want to pose related to influences of culture and mindset, environments to navigate, historical and social factors. So the reason I bring this out here is that as we're trying to define our question, it is important to be really clear about what is in our scope. What kinds of things would be useful for us to know or consider? So we can keep this idea here of body weight and eating habits and physical activity and some of these contextual factors that we might want to incorporate in our investigation of the evidence. Now, this framework particularly was developed by and for African Americans, which might be really relevant depending on the population that you're interested in. So on the next slide, we do get to defining population. So we're back to PICO here. And in the scenario that I just described, we might describe the population as children 0 to 5 years in an early childhood education setting. And here I haven't specified that we're particularly interested in African Canadian population, but we might want to specify that if that was something that was of particular interest. So what I'm showing you here is an example of how you might frame the population, but of course you would do that to make that more specific to your context. The intervention, we might say, well, we're interested in finding evidence about intervention that is intended to improve healthy weight or diet or physical activity, because the framework has already suggested to us that those might all be factors that would be relevant. We compare that to no intervention, so we want our intervention to be perhaps better than doing nothing, or perhaps just better than what normally happens. So we call that usual care. And outcome, what outcomes would we be interested in seeing in the evidence? So change in BMI might be one of those outcomes. It might be something related to changed eating habits, might be related to changed physical activity. So this is a place to start as you go forward to look for evidence. As we go forward, you'll see that if we discover that our definition wasn't specific enough, we can always go back. So although we're going to follow the steps in a linear way, sometimes the actual process is not really linear. You cycle back a little bit, refine your definition, and so on. So this is our place to start, given the scenarios that we're working with. And I have a tool for you. So there's a tool called Developing an Efficient Search Strategy using PICO. The link is there to the registry entry. And this will help you to develop an evidence search question using the PICO format. So the link there will take you to the registry entry, but then there will be a link to the actual tool, which looks like this. The tool was actually developed by Health Evidence. And what you'll see there is just some prompts to help you say, okay, what do I say about the population again? Or what is it about the intervention that I want to specify? It says there on the left from a clinical question. It doesn't have to be clinical. It can be a community-based question. It can be applied. The tool says that, but it certainly works for other contexts as well. So what we're doing here is just starting to think about finding evidence. First of all, we need to know what we're looking for. So the PICO can just help to nail that down a little bit. The next step, once we've defined what we're going to look for, is the search. Now we start looking. And a key thing here is to efficiently search for research evidence. And we really emphasize this to focus on the efficiency part, because we at NCCMT, we're mostly working with people who are in practice, not people who are doing research all day, but who are using research. And so efficiency is important so that you can actually get through it and move toward actually applying the evidence. So we're really being pretty focused on being efficient in our evidence search. So one tool that I can suggest for you is the search pyramids that we have at NCCMT. The link is there. And I'll show you what the tool, the pyramid looks like. These pyramids are pre-populated with good websites for finding evidence related to, it's framed as healthy habits. There's one for adults and there's one for children. And the idea with the pyramid, what makes it a tool, is that it takes you through the process of searching for evidence. And we suggest with the pyramids that you start at the top. So let me show you. by starting at the top of this pyramid, and this is the one for healthy habits for children, we're looking for systems and summaries, so guidelines, best practice documents. And we like to start at the top because we want to be focusing on evidence that is already synthesized for us. That's what makes it efficient. So someone has looked at all the evidence, brought it together so that we can look at it all in one place, maybe made some recommendations around it. Often that's what you will find in summaries. And then on the right side of that pyramid, you'll see some suggested sites. So National Guidelines Clearinghouse, for example. And one good thing about the National Guidelines Clearinghouse is that these guidelines are pre-appraised. What that means is that someone has looked at the quality of the process that went into developing that guideline, which is good for you if you're after efficiency because you don't have to do the appraisal if it's been done for you. Now, there are other sources of summary data that you will find. So further down on the page, you'll see public health resources related to the NHS evidence, which is in the UK, some sources there about healthy eating and physical activity. Lots of evidence there that you may be interested in. However, you would have to do the critical appraisal of those sources because it has not been done for you. It doesn't mean it's not good. It just means we don't know. So buyer beware, you have to check that out. So we're starting at the top of the pyramid and looking for guidelines. And what I would suggest here is, well, let's actually go to the National Guidelines Clearinghouse and see what we find, which I did. So this is just a screenshot of what we find if we put in healthy weight as a keyword at the National Guidelines Clearinghouse. And I made it a little bit more specific by checking off that I was interested in the target population of children, here defined as age 2 to 12 years. So if I enter that search, what do I get? And you can see at the top that it tells me or it reminds me what my keyword was, what my population was, and what it pulled out for me. So we get 115 guidelines, which is a lot. There's no way that you could actually go through 115 guidelines and still have a life. What we do see right at the top there is something that might actually be pretty interesting given the topics that we have for our scenario: maintaining a healthy weight and preventing excess weight gain among adults and children. That's pretty on target. And there may be other things further down in those 115 hits that would also be useful for you. So lucky us, we found a guideline that seems to be relevant. And if you click on that to see actually what's behind it, you'll see that the National Guideline Clearinghouse has described the guideline, how it was developed, what their appraisal of it is. So you get a lot of background information before you even go to follow the link to that guideline. The other thing I'll mention to you, if you're trying to be effective in using evidence for whatever it is that you're doing, going to these databases, and here you would go sort of to the next step, click on something that you like and see what's behind it. It can really be helpful if you're not quite sure what keywords to use. Because if you find one piece that's relevant and see how that was described or keyworded, that will tell you what else to search for. So in this case, I don't think we're struggling too much, but sometimes if your search is something a little bit unusual or esoteric, or you're finding a little here, a little there, and you feel like, you know, you're not quite maybe finding everything that's out there, look for how the sources that are on target are keyworded, and then those keywords can be used in your search. Now, one thing I would say, and I actually did go and look at this guideline, it's not very specific to the ECE setting. So it gives us some general recommendations, but we might not quite be finished with our search here. Sometimes you will. Sometimes you'll go, you'll start at the top of the pyramid, you'll look for a guideline, and you'll find one that's just right on target. And if it is, that's your lucky day, because someone else has done all that work of pulling together the evidence for you. You're still not done. There are still other steps to go through, but your search can get really easy if you find a really good on-target guideline. However, in this case, if we still want to see what else is out there that might help us in the ECE setting, we go back to the pyramid, same pyramid, but we're just moving down a little bit to look for syntheses and synopses of syntheses. In that kind of middle bar, what we're looking for here is things like systematic reviews, meta-analyses, and so on. And one really good source of syntheses and synopses of syntheses is healthevidence.org. So I'm going to talk about health evidence in a moment. But whether you go there or whether you go somewhere else, looking at systematic reviews is still a good source of evidence, because someone else has done a lot of the work for you in a systematic way. And from an evidence use point of view, it's really important to be systematic in the evidence that we're looking at, and not just picking out certain research that we happen to like and leaving aside other pieces. So if we go to healthevidence.org, and there's the link, this is a screenshot of what the front page looks like, and I'll show you a little bit how it works with some particular features that may be relevant for work in healthy weights promotion. So a really easy way to get started on this site is to just put in your topic, healthy weight, and you'll see right in the middle there that in the little red box it says healthy weight. The index will actually help you. So as I'm typing healthy, it comes up and says, is this what you meant, healthy weight? So I know here that this is a term that it recognizes because it came up in the red box there. And if I just enter that search with nothing else, I get 116 results. 116 systematic reviews is too many. And I say that because there's no possible way that you could be systematic in going through all of those. So if I got a result like this, 116 systematic reviews, I would go back and refine my search. I've cast the net too widely here, which is a good place to start. It's not a mistake. It's just to say, okay, I've got some room to play with here. I could be even more specific. So what would that look like? Well, we go back to the searching front page and do what's described as an advanced search. And I would encourage you, if you're using health evidence, to use this advanced search feature. If you do advanced search, it will take you to kind of a clickable menu, so you can put in your terms at the top. So healthy weight, for example, is still right at the top. I know it's a little bit small. And then also right at the bottom, under setting, we can check off daycare center. And that will get quite a bit more specific for us. So just by saying healthy weight and then specifying daycare, we go from 116 systematic reviews to 9. And that's much more manageable. We could probably all manage to take a look at 9 or so systematic reviews and feel that we were doing justice to it. So I'm not going to take you through 9 systematic reviews, but I will draw your attention then just to the first one there, which is from 2016, and we like things to be as recent as they possibly can be. So just by looking at the title, we can see whether it's relevant for us. obesity prevention and obesogenic behavior interventions in childcare, a systematic review. Well, I probably couldn't have said it better myself. That seems pretty on target. So this is probably one that we would look at. And there may be others on this list that we would look at as well. Now, one thing that you'll notice also just in the part that I circled there is that there is a rating, and for this one it's moderate. This is a rating of the quality of the assessed quality of the systematic review. Systematic reviews are quite complex to do, and some of them are done better than others. So ideally, we would look at a strong review, and there are strong reviews there. This one was moderate. So let's take a look at what happens if we follow that link. What you get is the citation, you get the abstract that comes right from the article. You can see how it's keyworded at the bottom. So as I said, if you're wondering, how is this kind of content indexed, it might help you. But back to the top, you'll see that the rating was a 7, that's out of 10. So that gets it a moderate quality rating. If you want to know what the quality assessment was and maybe why it wasn't a 10, you could actually follow that link and understand a little bit more about the quality appraisal. And the question you would ask, because you're going to be a good evidence user, is the limitation on the quality of this systematic review something that would make me be concerned about it, make me feel that perhaps I wouldn't trust the evidence that I'm finding here? So even though it's been appraised by health evidence, you still probably would want to say, well, let me take a look at that appraisal and see whether I agree with it and how concerned I might be about the limitations. Now, we might go through other systematic reviews. We might take a look at that one in more depth, and so there would be more to do certainly around just exploring what the systematic reviews can tell us. And we're working our way down the pyramid, but you don't always go right to the bottom. If you find everything that you need, perhaps in a synthesis, like a systematic review, you can stop, because the idea is that the pyramid is based on the foundation that's below it. So a synthesis or a systematic review that's in the middle is a synthesis of studies that were done and that are shown in the bottom of the pyramid. So you don't need to go and look at all the single studies if that synthesis has been done to pull them together. So again, this is an efficient process for using evidence because someone else has done the work for you. But sometimes you still have a question that isn't answered in a systematic review. And sometimes then you really would need to go to what we call single studies, single research papers. And if you need to do that, PubMed is a good source to try for health and medical literature in general. Remember from the initial scenario that I gave you that perhaps in this case you are interested in what research has found about weight bias, or whether interventions can increase weight bias or weight stigma. So you could look for a synthesis on that and see what the evidence is. I actually did that, and I can tell you that there isn't something specifically at the review level in health evidence around weight bias or weight stigma. So this would be the kind of question where we would say, okay, we're working our way down the pyramid. I do want to know what the evidence can tell me about weight bias. I'm going to have to go further down the pyramid and go to those single studies. So that would be a case when it would make sense to go if you didn't find anything at the synthesis level. Now, the the concern that we have about going to the single study level is there's a tendency to cherry pick, to pick out those studies that we find agree with our perspective, or just pick out the ones that come to the top when we type it into Google, or choose the ones from the authors that we're familiar with. None of those strategies is systematic. And so if you're not being systematic about what studies you're looking at, what's happening is that there's a bias being introduced. So if you're picking out some studies and leaving others aside, not for a good reason, but just because they didn't rise to the top, then you're not getting a full picture of what the research can tell you. And if you want to be using evidence effectively to make good decisions in your practice, you want to at least say, I gave it my best shot. I was systematic in how I looked at those studies and those papers. So that's just a word of warning. If you do have to go and look at single studies, have a strategy for it. Are you going to look at the most recent pieces? Are you going to look at the ones that are most on target for you? But do it in a way that you're not introducing bias into what you're picking out and what you're leaving behind. Lots more that we could say about searching for single studies. But there are some sources listed here as well, so you can go to PubMed, as I said. You can go to Public Health Plus, as shown, and that will give you pre-appraised sources that are relevant for public health practice, and it's done in a systematic way. The Canadian Best Practices portal, probably familiar to many of you, is a good source to consider as well if you're looking for what's happening in Canadian communities. And there are others that you'll find in that pyramid as well. So searching can be really a time-consuming process to do well. So our strategy is to start at the highest possible level on the pyramid. One good guideline, one good best practice document can save you a lot of time because someone else has done the work for you. And if they've done it in a good way, then that really is an efficient process. So getting those sources that are pre-appraised gives you a sense that you're getting good quality. If it hasn't been appraised, you should do appraisal yourself, and I will talk about that in a moment. If you want to learn more about how to search, and there really is a lot to learn about how to do this well. Many people on this webinar probably know quite a bit about this. But if you want to dig in a little bit more, there is a module on searching through the Learning Center at NCCMT. So I would encourage you to explore that if that's of interest to you. So our next step here is related to appraising. And so as I was said, sometimes you get lucky and the sources that you're finding have already been appraised by someone else or some organization that you know does a good job of appraisal. So if that's the case, that's fantastic. You want to be checking on that at least. And if the appraisal hasn't been done, then you should be doing it. So what does that step entail? Well, lots of tools out there that can help you with this step of appraising. And, you know, of course, and they're listed here, the registry entries are there. If you're looking at a practice guideline, like the one that we first saw when we started looking at the pyramid, the Agree To instrument is one that's particularly meant to appraise practice guidelines, best practice documents, and so on. If you're looking at a systematic review, the AmStar tool is one that we recommend. If you're looking at different kinds of single studies, there are checklists available at the critical appraisal skills program for different kinds of studies, qualitative studies, randomized controlled trials, I think 7 or 8 different kinds of study design. So if you do need to actually do the appraisal yourself, then it's great to have a tool that can help you to do that. When we're appraising the research evidence that we found, what we're doing is trying to filter the initial results of our search, looking for sources of bias. So trying to answer the question, is this research or systematic review of good enough quality that I should read further? And sometimes the answer will be no, and then that gets thrown out of your search. So if you say, you know, this was really poorly done research, or it's a guideline that's just based on someone's opinion, they didn't really look at the evidence, or other reasons that would make you say, you know, this is not of sufficient quality that I would want to base any kind of decision on, don't read it. Find something that's of good quality so that when you go to make your decisions, you can have confidence that you're making good quality decisions based on good quality evidence. Now, sometimes when people start doing this appraisal process, they say, well, you know, but all research has flaws, and it's true. All research does have flaws. Even things that are appraised as a 10 probably could have been done a little bit better if we really thought about it, if money was no object, if time was no object. So we're not looking for perfection here, but we are looking to see the extent to which bias might have crept into that research or that review, and if that bias is serious enough for us to really not trust those findings anymore. If you aren't quite sure what would be serious flaws and serious bias, there are some additional resources that I can suggest to you that will help you do that appraisal process in a little more detail. Again, there are some online learning modules at NCCMT. There is one specifically related to appraisal. And if you really want to dig into this, there's a week-long course every year at McMaster. It happens in May, so we missed it, but get ready for next year, and you could follow the link there to see when exactly that is. So we're moving around on our wheel now. We've defined our question. We've searched for some evidence, and we found some good quality sources. We've appraised them, or at least we've checked to see that someone else appraised them and that they're of sufficient quality that we would trust what they're telling us. Now we are at the synthesize step. And so at this point, we're trying to interpret the information that we're finding. And sometimes if we have conflicting results, we need to figure out how to pull all of those together. So that's what happens in the synthesize step. A tool that I can recommend for you is a briefing note tool, and the link is there. This briefing note tool is really intended for briefing notes to help you make decisions, as most briefing notes are. And so we're moving toward trying to develop actionable messages to inform program and policy development. That is, we've looked at the evidence. What should we do, or what should we consider doing? If you go to look at that tool, this is what you'll see, and there's more to it than even what you can see. It's just a helpful structure to help you go from all the evidence you may have found to moving toward a decision. So there are sections in here about what's the issue, the background, the current status, you know, why are we even looking at this, and what are we currently doing on the topic. And then there are some prompts related to the evidence. What is the research evidence telling us, and what do we know from that? What are people saying? What did the experts say? What's the political context? All of those evidence pieces start to come into it as we look at this briefing note structure, which can be a helpful way of synthesizing. When you are synthesizing, you're wanting to bring good quality evidence together to determine, first of all, what were the results? What did we even learn from all of this evidence that we've looked at? And perhaps more importantly, what are the implications? What does it mean for us as we go forward in making decisions? Sometimes what happens is that results conflict, and this can be very annoying for people. I found one source that says that this strategy can work for healthy weights promotion, and then I found another source that says, no, that doesn't work. Often what happens when you're seeing a conflict is that it's not exactly a head-on conflict. It's probably more a question that one source is of greater quality than another one. And so if that's the case, you prefer the one that's of greater quality. So you might actually eliminate some sources if you find at this point that, yeah, really the quality is not there to really rely on some of it. We always tend to prefer evidence that is most recent because people are doing research all the time. Perhaps they found new things, explored new questions that can help us. And things that are most relevant. So even in the simple examples that I have given you, we found a guideline that was pretty general about healthy weight in adults and children, but it didn't tell us anything about early childhood education settings. So we would probably be more interested in the results of a systematic review that actually talked about ECE settings. So look for those things that are most relevant to your particular question. And of course, we're always interested in those actionable findings. What can help me actually make a decision? And I know sometimes people have a frustration because the conclusion comes from the research or the review, more research is needed. You've done all this work and that's all they have to tell you. So it is a frustration that happens sometimes, but even at that, there are usually some pointers that they can say, you know, it looks like there's some possibility here. We don't know for sure, but there are some hints. And remember right back to the definition that I gave you about evidence-informed public health. We're looking for the best available evidence. So if the best available evidence doesn't completely answer our question, we take it for what it is, and we build on it, and we bring in those other sources of influence on decision-making, like local preference, our experience, our expertise. All of those things can still come into helping our decisions along. The next step in the process is adapting the information to the local community. And I'm going to bring you back to the model that I showed you right at the beginning because it's really helpful for trying to adapt to a local context. So I'm not going to be really specific about what the evidence was saying about healthy weights, but I'll just give you a flavor for what happened when I looked at the guideline that I found and that systematic review that I found in the previous slides. So the guideline suggested that multi-component interventions seem to have the greatest effects, not just doing one thing, but approaching healthy weights on many levels and with many factors and components. So, okay, that's a piece of evidence. What does it tell us about working in ECE settings? Well, not that much. So then we go to the systematic review, and what we found there was that there are interventions that can be effective not only at promoting healthy weights, but also at promoting healthy diet, healthy or increasing physical activity. So there are some strategies that have been identified to be able to affect all of those outcomes that we were interested in an ECE setting. So if you want to know what those are, well, you know how to look at health evidence now, so you can go and look and see a little bit more detail. But what I want to point out to you here is that the research suggests that we can be effective in working on these issues in ECE settings. There are some interventions that seem to help. And we recognize in looking at this model that that's a really important piece, but it's just the research piece of this model. So the research tells us certain things. And when we go to make decisions about what we might do, we still take into account other aspects before we make our decision. So as we think about what we might implement in our community, in our ECE settings, we bring in questions about, would we actually do that intervention? Is it practical here? Would it be acceptable? Can we afford it? So public health resources come into it, both in terms of our expertise that we have and in terms of the cost. So we start to think about not only what the research evidence says, but what's practical, what could actually work in our context with the populations that we have, given how much time we have, and so on. All of those factors really come into making a good intervention. And the framework can help. So back to the framework that we started with when we were even just trying to frame our question, frameworks can be really helpful when you're looking to adapt to local context as well. And again, this framework talks about or identifies some questions that we might ask about culture and mindset, some questions about environments, questions about historical and social factors. So this step in the wheel, the adapt step, is really, it's probably as much art as science, maybe even a little bit more. So what we're doing here when we're adapting is we're asking questions given our understanding of the local context. And there are tools that can help us. So there are 3 tools, actually, that I'll draw your attention to. All good, all slightly different. So all of these are related to whether the evidence that we found can be applied and transferred to our local setting. So the first one, it worked there, will it work here, is a tool just for asking yourself, and it's really great to do this with a group too, to get people's sense of, okay, is our context similar enough to what we saw in the evidence that what worked there might work for us too. A similar tool, actually based on the first one, is called Is this evidence useful to me? As I said, it's similar, but it's got additional health equity context. So if you're working in an area that has health equity implications, and really most areas do, this might be a tool that would be of particular interest for you. And then the last one listed there, will it work here, is probably even more oriented to questions that decision makers will ask about whether they should implement a new intervention. So all of these tools can really help to just prompt you to think about what would be important when you're trying to move the evidence into practice. And there's an online learning module through NCCMT for this piece as well if you want to explore that in more detail. So when you're adapting, you're thinking about all these factors. How can you make things really appropriate for your community? So we're moving toward that decision that will be the right one that's based on evidence, but will also be the right one for our context, our setting, our populations. And sometimes when we're adapting, we need to think about what's already in place. And if we introduce something new, would we have to stop doing something else? I know in every context I've ever worked in, it's not like people are sitting around really with nothing to do. So if you introduce something new, it does mean that you have to stop or cut back on doing something else. So if we're trying to be evidence-based about our decisions related to healthy weight promotion or anything else for that matter, we do need to think about the decisions that we make in the broader context. If we introduce something new, what effects does it have on what other people are doing, our partners have in place? Would we need to stop doing one thing in order to do this? There's no perfect answer to these questions, but you do need to think about them if you're going to implement successfully. So moving right along, in our wheel, now we're at the part that we probably always wanted to get to, the implementation stage. So we decide whether to implement a change and then plan how to do it. So we've gone through that process of adapting and thinking about what might work for us. And then if we're moving ahead to actually implement something, there's a tool from the CPHA. The link is there to the registry entry about this. It's called a tool for strengthening chronic disease prevention and management through dialogue, assessment, and planning. This guide is about more than implementation for sure, but I bring it up here because it's really good around stakeholder engagement. Stakeholder engagement, of course, can happen at any point and probably should happen at every point in evidence-informed decision-making, which is the process we're talking about. But I've brought it up here because I feel that it's a really good guide to engaging stakeholders around implementation considerations. So what should we do? What would be involved? How can we involve other partners? The management aspects of implementing a new intervention. This resource also has case studies that you can draw on and some worksheets that can be really helpful tools to use. So I certainly recommend this tool for strengthening chronic disease prevention and management, and of course very relevant for the chronic disease prevention field because it was designed specifically with that in mind. So I won't say a lot more here about stakeholder engagement, but just to say that many of you probably have some very good experience or perhaps examples that you'd want to share in our Q&A about how stakeholders can be involved in an evidence-informed process. You know, we're talking about this almost as like it's a planning or it's an evidence use process that you can just do at your desk, you know, you yourself, but it's really strengthened at every point in the process if you bring in other people from different perspectives and from particularly populations that are going to be most affected. Now, our final stop on the wheel is related to evaluating. And here we think about evaluating not only the intervention that we implement, which of course is important so that we know what's working, but also we reflect on our own process of using evidence. We evaluate our use of evidence in making decisions. And there's a tool that I can suggest to you. It's called Improving Future Decisions, Optimizing the Decision Process from Lessons Learned. It's it looks like this. I know it looks similar to the other one, but it's actually different. So here we describe what your decision was. So, you know, we looked at the evidence and we decided to do this. And then sometimes, I don't know if it's happened to you, but it's happened to me that the best laid plans didn't quite work out that way. And so we can learn from our process of using the evidence and then translating that into action, both by looking at things that did work and things that just never really got off the ground. People resisted it, or we didn't have the resources needed to really implement that intervention. So this is where the rubber hits the road. It's not only about what does the research evidence tell us, but what was actually possible for us to implement. And sometimes there's a difference there. So we can use this tool to find prompting questions to help us to sort out what was effective in our use of evidence and what we could do better next time. So we're always learning about how to do evidence-informed decision-making. So you're thinking about your process and what you can learn from it. You're thinking about how you'll know if a practice change actually happened, whether the implementation worked well at your local level. Sometimes, of course, for evaluation, you need to gather baseline data if you want to really look at change. So that's something to think about early on before you implement. Well, there we go. So that was a quick trip through these 7 steps with methods and tools to help you do each of the steps, with a focus on a healthy weight scenario. So trying to make that relevant and bringing out resources that are specific to healthy weights or chronic disease prevention. Some of the methods and tools, of course, are generic, and you just apply them to the scenario that you're working with. But some of the tools are perhaps specific to this field. So just thinking about the methods and tools that that we've described today, I'd love to know whether whether these are new to you or whether you've used them or heard about them. And by the way, as you're clicking away, we will be going to questions. So you can start to enter questions and comments in the Q&A box as well, and we'll get right to those. I'm looking forward to some good conversation through that method. So let's see. Yeah, so many of you have, we can close that poll now, I think, Lena, thank you. And yeah, so probably a third of you have used one or more of these tools, so I'd love to hear your experience with them, if you can share that. Some of you have at least heard of the tools, and for some of you, this was, you got some new stuff here, so hopefully that will be valuable for you. So you've probably had experience working with evidence-informed public health, trying to take this approach to decision-making. So it's a hard choice, but which of these steps in evidence-informed public health would you say is the most challenging to do well? And as you're clicking away, you may also be thinking about some of the questions or conversation that, that we might have from here in terms of what is it that makes it challenging for these steps, or what have you found helpful in taking these steps to evidence-informed decision-making. So results are coming in, so appraisal being difficult. Using the right tool can help. It's certainly some work there. I won't deny that, but certainly some challenges involved in doing the appraisal process well and effectively. But response is pretty much spread across the different options there. Challenges with all of those steps for sure. So just give me some feedback. The methods or tools that we described today, to what extent will these be useful in your practice, do you think? And if you have questions about how they might be useful, enter that in the Q&A and we'll get right to those. So great, people saying very useful or somewhat useful. Certainly hope that that's the case. Some of you are honest and say, well, I don't know, I'll have to find out. So yes, do find out. Let's see what we can learn and share about this process. If you have feedback for us at NCCMT, if you go on the website, there is a contact us. And really, we're always happy to hear about your experience with the methods and tools that you're finding there. If there are other things that you think should be added, we're happy to hear from you as well. So let's think about what your next steps might be. Do you think that you might access a method or tool that's been referenced here, or go to the site and read a summary about one of those methods or tools? Will you use it in practice? Will you tell a colleague about something that you heard? And you can just give us some feedback on that. Accessing, well, that looks great. Hope you find some things that are valuable for you. Reading the summaries will help you to see whether a tool might be the right one for you. Great, so I think we can close that one, Lena, and thank you. So good luck to all of you who are planning to access some of these tools or read about them, sharing that good news with your colleagues. Now let's get to your comments and questions. Thank you for indulging me in answering my questions to you, but the Q&A is open, so please type in your questions or comments or things that you have found helpful in using evidence in the work that you do. So, okay, questions. Sound keeps going back and forth. What can I do? I'm sorry. I'm sorry to hear about that. I don't know whether there's anything. Hopefully that has sorted out now. I can tell you, of course, that the slides and the audio recording will be available, so I'll just flip to that slide now, although we're still very interested in your comments and questions. But the recording will be available in English, and the slides available in both English and French at these links. So if you feel like you missed something, you can find it out there. So comments, thank you for the informative and interesting presentation and tool. Well, super, thank you for your attention, and I'm hoping that you have good luck with this. So official learning credits for this activity, not from our end, although you may be able to pursue that with your organization. There are accreditation kinds of credits that are available if you go on a website and complete online learning modules. So if that's something, if you're looking for professional development kinds of opportunities, check out NCCMT and see if there are modules that are interesting to you. So a question here that actually came in quite early, so thank you, Pat. There's much discussion about the approach, health at every size. Do you consider this approach to healthy weights promotion to be evidence-based? And is it recommended as a method or a framework? And is it the only or the best way to avoid weight stigma and bias? Right. So fantastic question, lots there. So is this approach to healthy weights promotion to be evidence-based? Well, by following this process that I described in the wheel, this is actually a question that you can answer, and I would say probably should answer, if you're starting to think about a particular module or a framework that's out there. I mean, I could sit down and write a framework at my desk now, and so could you. But it might not be evidence-based. It might be my opinion. It might be because I had some issue to flog. And so it is a question of bringing that critical lens to every approach that you're thinking about using. So you should be asking, what evidence was behind this? Where are other sources of evidence beyond research evidence coming into it? So values can come into things. Historical practice can come into it. It's not that those influences are wrong or incorrect or not part of evidence-informed decision-making. All of those things come into our decisions. And so in Health at Every Size, we certainly want to think about doing no harm in the interventions that we implement. So that's part of our decision-making, absolutely. Whether the evidence that's behind this stands up to scrutiny is a question that you can and should ask. So if you want to appraise the quality of evidence, first of all, you need to know what the evidence is behind a framework, if you find one. And then take a look at what the process was for coming up with that evidence and developing that framework. Were experts consulted? Was there a process that a framework went through in being developed? So lots of ways to answer that question about, is this or that framework evidence-based? Should we recommend it? So there are probably people better than me on this call to really reflect on their success with using Health at Every Size. But it's certainly been influential in bringing out those issues associated with weight stigma and weight bias, and so therefore certainly worthy of our consideration. So if you've got comments or questions about your own experience using and applying that framework, please enter them again. So question, can you display the evaluate graphic again? I sure can. I'll bring that up, and then I'm not sure if you wanted the tips or the tool, so I'll go to both of those. And that was a question from John, so thanks, John, for that. Hopefully that's showing you what you need. Yeah, so a question, can you display the evaluate slide graphic again? So let me know if this is what you wanted to respond to. Other comments or questions? The graphic wheel, yeah. So in the evaluate step, we're assessing the effectiveness of the change in practice or policy. So maybe you have a question related to that. Another question that's come in, is there evidence to show the effectiveness of these tools? Fantastic question. You're already starting to think about, what's the quality of these tools that I may be using? So, which is why I send people to the NCCMT registry as opposed to just going straight to the tool, because the registry, in the summary that's written there, will tell you whether there's any evaluation that's been done on the tools. Sometimes there has been, and sometimes there has not, but at least it's good to know, and we'll summarize that there for you so that you'll know how much confidence you should have in whether that tool is of good quality, where it's been applied, what the evaluation data say around it. So by following the links that are provided in these slides, you can go to the registry entry and get that kind of background information on the method and tool. So I'm not sure if there's still a question to come about the evaluate slide. I am an evaluator by training, so I always love it when there's an evaluation question. So you'd make my day if there were. Just watching to see if there's anything else that comes in about that question. You will be able to pull these slides off the slideshare.net/NCCMT, and the audio recording will be available on YouTube. We just need a little bit of time to get that processed and up there. And as I said, I'm an evaluator by training, so we will be sending you a link right after the webinar as soon as it closes. And we really do value your feedback on the webinar. We're actually making a series like this. So I've done one related to mental health methods and tools for evidence-informed decision-making. We have a couple coming up in June related to infectious disease and related to injury prevention. So if you have feedback now about how this webinar went, I can incorporate your feedback in the upcoming webinars that I'm doing that are similar to this, but for different audiences and with a little bit of different approaches to the different areas of work. So a question, any suggestions or articles on Aboriginal views on health evaluation? Right, so thank you for that question. This is an area that I do a fair bit of work in. So perspectives on what counts as evidence can change depending on the population, depending on the cultural group or the context in which you're working. So we always need to think about that, the model with the Venn diagram, that research evidence is important, really important in the decisions that we make. But it's not the only thing that we consider when we make a decision. And this is particularly true when we're making decisions that would affect a population where there has not been a lot of research, or we may suspect that the research has been biased in some way or not inclusive enough in some way. And so as we think about those different circles in the Venn diagram, the research evidence is a piece of it, but the historical context is also important. Local customs are important. And so I would say this is particularly true when we're thinking about Indigenous populations, true for other population groups as well, that we really want to balance the research evidence with other considerations. Always true, but particularly true when we're thinking about the effects on vulnerable populations. The other thing I'll mention, if you're looking for interventions that are particularly relevant for Aboriginal populations, is in the pyramid, we made reference to the best practices portal, and there are some examples in that portal of programs that have been implemented in Indigenous communities, so that may be of interest to you if you're looking for specific examples. The question that John asked was really Aboriginal views on health evaluation. And so evaluation, I would say, is probably always context dependent. So the important question about what do we evaluate and what counts as evaluation findings that we would find important, that's it's something where the answer is not necessarily obvious to us. We need to ask people, what would you find important to understand in an evaluation? So depending on the population, and in this case the question is about Aboriginal perspectives on this, there may be very different or somewhat different ways of evaluating or evaluation questions with this population than you may find with others. So thanks for that question. I think we're about done for questions, so I'm just going to go right, right to the end. So I showed you, sorry, I'll click back one, that you can get the slides and audio. If you missed this information, we put this up on our website as well about recent webinars, so you can always get it there if you're trying to track down the slides for some reason. And our next webinar, we have one coming up on June 7th, so I will be presenting again with my colleague Leslie Dick from the National Collaborating Center for Determinants of Health. We're talking about a specific tool called the Equity Integrated Population Health Status Reporting Action Framework. Really long title, but really packed with good perspectives on how population health status reporting can be done from an equity promoting perspective. So if you're interested in learning about how to improve health equity and seeing whether health status reporting can be helpful in that area, this action framework may be of interest to you. So the link is there, but you can also find links to this webinar and others on the NCCMT website or on the Health Evidence website. The evaluation link is there and will come up as soon as you close. And I would like to thank you for spending this time with us today. If you are looking for more information, please go to the website or contact us at nccmt@mcmaster.ca. Have a wonderful day. Thanks, everyone. So long.